As you know, with this coronavirus pandemic, people's jobs have changed. Many people were asked to work from home. Some were furloughed, and others saw changes in their working environment, like social distancing and the introduction of PPE. Well, the Office for National Statistics has compiled this list of data that looks at deaths, COVID-19 deaths relating to occupations among men and women aged between 20 and 64 across England and Wales. And it's looked at a total of 4,761 deaths to examine the correlation between being exposed to COVID-19 and physical proximity. And it found that in 2/3 of those deaths, they occurred in men, and particularly men working in elementary occupations who had the highest rate of deaths. And elementary jobs can be described as routine tasks like construction workers and cleaners. And of course, you'll know that many of them are considered key workers, so they would have continued to go into work during this pandemic. And you can see from this table now that there's a list of jobs that had seen the most deaths, and this is in relation, as I said, to men. And you can see that security guards there right at the top with the highest rate of COVID-19 deaths. Now, when it comes to the social sector, both men and women saw significant raised numbers of deaths. And in the healthcare sector, so that's including doctors and nurses and people that work in hospitals like cleaners and porters, hospital porters, as a group, men had an elevated rate of death, but not women. But when you break that up into separate roles, nursing was the industry which had significantly higher rates of deaths, and that's for both men and women. Well, the Office for National Statistics didn't take into consideration ethnicity or socio-economics, but it did refer to a separate source, a survey, and that looked at ethnicity, and that found that specific occupations had higher mortality rates among Black and Asian ethnic groups. And for example, that was bus drivers, one of the examples there. And of course, next week we see further easing of lockdown measures with the opening up of the hospitality industry, so things like pubs opening up. And so we can expect these numbers to change if there is a further update from the ONS, because while healthcare workers are, of course, exposed to that COVID-19 risk, perhaps on a near daily basis, they do, of course, wear PPE, which isn't the case for hospitality workers who have that very close proximity with their clients and their staff, but perhaps don't wear the PPE necessary.